Hi, this is Dr. Janie von Wahlberg, and this is my friend, Katie, and we're here to talk to you about quality of life and your dog's mobility. Mobility is a big deal for dogs. They run, they play, they wrestle, they chase squirrels, they get up and they do what they want to do. They have their opinions, they make demands, they bark, they want attention, they want the door opened, they want to walk. Mobility is also a big reason why our dogs suffer a decreased quality of life and why ultimately we wrestle with the decision of putting them to sleep. For older dogs, it's very common to see their mobility decrease from what they used to do. It's also hard to evaluate their quality of life as an older dog and not as that puppy that you remember. Older dogs enjoy petting, hanging out with the family, being in the middle of the kitchen, licking food off the floor. They love belly rubs, ear rubs. They love listening to music with you. They love walking at their own pace. They love sniffing. So that figuring out their quality of life based on mobility, there is a big spectrum. On one side of the spectrum, there is the dog that can't get up at all. They can't walk. They need help to get up. They may vocalize or grunt or whine if you try to help them. On the other side of the spectrum is a dog whose legs shake, who gets muscle fatigue, who acts sore, who vocalizes when you try to pet them. All that makes it hard for them to be as mobile and active as they want to be. There's no right answer. Every dog is different. However, there are some things to think about. How can we improve their quality of life? The first way is with devices. So many owners have stairs. Sometimes you can cover the stairs with more traction. You can build ramps. You can use mobility devices like lifts or wheelchairs. Other things you can do to help them be more mobile is to control pain. Common types of pain control include non-steroidal anti-inflammatories. The most common of these is carprofen. There are other varieties of anti-inflammatories that are easier on dogs' digestive systems. Ask your vet. If your dog has a reaction to one, please try another. They are best given with food and they are best given consistently. Other types of pain medications include opioids. There's an opioid called tramadol that we're learning is only effective in some dogs. We are also very concerned about human abuse of tramadol. Again, please ask your vet about what options they have available. There is a medication for spinal pain called gabapentin that's also very good for severe pain. Sometimes just starting one of these medications can really help your dog's mobility. There are options. Please talk to your veterinarian. Mobility is a big deal for our dogs. It makes them happy, it gets them outside, it makes them able to go potty, and it's a big deal when mobility starts to decline. Hopefully, we can use some of these things I've talked about to increase your dog's quality of life and keep them walking.